Today we're going to demonstrate exercises targeting the stabilizer muscles of the hip, more specifically the gluteus medius and the deep lateral rotators, also known as the rotator cuff of the hip. The first exercise we call the side-lying clam exercise. The patient is lying on their side with the knees bent and the bottom of the feet are in line with the back. Also, the pelvis is perpendicular to the surface that they're lying on, and the hand is placed on the pelvis to monitor for movement. The patient pulls in the belly button towards the spine to activate the abdominal muscles to stabilize the pelvis. The feet are kept together. The patient then lifts the knee as far as they can without any movement in the pelvis. And they return to the starting position. You should feel the muscles in the back of the hip contracting with this exercise. Perform 15 to 25 repetitions once to twice a day. This next exercise is to isolate the gluteus medius muscle. The patient is lying on their side with the bottom leg bent and the top leg straight. The pelvis is perpendicular to the table, and the back of the heel is in line with the back. The patient puts a hand on their pelvis so they can feel for movement. You're going to pull in your belly button to stabilize the spine and the pelvis. While keeping the spine and the pelvis stabilized, lift the legs straight up to horizontal. Turn the foot out slightly, and then back, and then return to neutral. It's important when you lift the leg that you do not let the leg go forward. You keep the leg in alignment with your back, and there's no movement in the pelvis. You can perform this exercise 15 to 25 repetitions twice a day. You should feel for muscle contraction in the upper part of the outside of the hip. The knee move inward. You're going to hold that for 5 seconds. Repeat 5 to 10 times. And as you get stronger, you can gradually increase the amount of time you're holding and the number of repetitions. This next exercise is a more advanced exercise, further focusing on strengthening the gluteus medius and the deep rotator muscles of the hip and weight bearing. The patient stands perpendicular to the wall. We're going to be working on the left hip. The left foot should be parallel to the wall. The patient bends their right knee, placing that knee against the wall. Then they're going to push so that their hip and shoulder are off the wall. Bend the left knee slightly. Then keeping the left knee slightly bent, keeping the pelvis horizontal, you're going to turn the left knee out slightly and hold that position, not letting the right pelvis drop and not letting the knee move inward. You're going to hold that for 5 seconds, repeat 5 to 10 times, and as you get stronger you can gradually increase the amount of time you're holding and the number of repetitions.